My name is Peyton Combs. It is August 30th, 2024, fall 2024 semester, and this is my head-to-toe assessment. I'm going to start by scanning the room. So there's my patient, my supplies, the floor, the ceiling, and the countertops. Okay, so we're going to start by assessing the patient's skin on his head, neck, face, posterior and anterior chest and abdomen. We're looking for skin color, temperature, moisture, turgor, texture, edema, and for any bruising, scars, lesions, or nevi. So overall his skin is normal for ethnicity. It's warm, clean and dry and intact, and there are no scars, bruises, lesions, or nevi noted. Next, I'm going to assess the patient's head. It is normocephalic, midline, and symmetrical. I'm going to look at his scalp and his hairline. So his hair is fine in texture with unequal hair distribution. Color is brown, and there are no masses, depressions, deformities, or infestations noted. Next, I'm going to palpate for temporal artery for his, if he has any tenderness. Is that tender?
No.
Okay, now I'm going to palpate his lymph nodes and his head and neck. We're going to start with preauricular, postauricular, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. Any tenderness?
No.
Okay, so we're going to assess for TMJ. So open your jaw and move it from side to side and close it. Any tenderness?
No.
Okay, and no crepitus or subluxation noted. Next, I'm going to assess for cranial nerve 5, trigeminal nerve. We're going to assess for motor and sensory. So for motor, I'm going to have you open and close your jaw again. Any tenderness?
No.
And then for sensory, let me know where you feel my touch. Close your eyes.
Cheek, chin, forehead, nose, cheek.
Okay. So cranial nerve 5 is intact. Next, we're going to assess cranial nerve 7, the facial nerve. So if you will smile, frown, raise your eyebrows, puff out your cheeks, and poke your lips. So cranial nerve 7 is intact. Next, I'm going to assess the patient's ears. We're looking for symmetry, so they are symmetric. There's no masses or deformities noted. I'm going to go ahead and palpate his pinna and tragus for any tenderness. Is that tender?
No.
Okay. I'm going to go ahead and assess his tympanic membrane and auditory canals. Okay, so his tympanic membrane is translucent and pearly gray, and his auditory canals are clear bilaterally. Next, I'm going to assess cranial nerve 8, vestibulocochlear. So if you will cover your ear on the opposite side of me and repeat what you hear me say.
Hospital.
Okay, and switch sides.
ABC.
Okay, so cranial nerve 8 is intact. Next, I'm going to perform the Weber test. So if you can tell me if you hear the ringing on equal sides or if it's louder on one side than the other.
Equal.
Okay, now we're going to do the Renna test, and I'm going to have you tell me when you stop hearing the ringing.
No. No.
Okay.
Now. Now.
Okay, so air conduction is greater than bone conduction bilaterally. So next, I'm going to assess the patient's eyes. I'm looking at his eyebrows, his eyelashes for palpebraal fissures, and his sclera and conjunctiva. So his sclera is white, his conjunctiva is pink, and there are no lesions or discharge noted. Next, I'm going to assess cranial nerve 2, the optic nerve, by using the Snellen chart. Usually I would be 6 feet away, so if you can cover your left eye and read the lowest line you can see.
LTFPH.
And then cover your right eye And read the lowest line.
LTFPH.
And with both eyes open, read the lowest line.
LTFPH.
Okay, so patient has 20/20 vision. Now we're gonna check his peripheral vision. So if you will cover your right eye as I cover mine and tell me what number you see.
2.
Okay, and switch.
4.
Okay, so patient has good peripheral vision. Next, we're going to assess cranial nerve 3, oculomotor. So if you can look at that back wall for me while I shine this bright light in your eyes. Normally I would dim the lights for this. Okay, and we're going to test for accommodation and convergence as well. So if you'll continue to look at that back wall and then focus on my finger all the way to your nose. Okay, so perla is noted in the patient. Next, we're going to assess cranial nerve 3, oculomotor again, cranial nerve 4, trochlear, and cranial nerve 6, abducens. So if you'll follow my finger in the 6 cardinal directions. Okay, so cranial nerves 3, 4, and 6 are intact. Next, we're going to assess for patient's red reflex. Again, I would dim the lights for this normally. Okay, so patient's optic disc, macula, and red reflex are present bilaterally. Now we're going to move on to assessing the patient's nose. It is midline and symmetrical. We're going to check cranial nerve 1, olfactory. So if you can close your eyes and tell me what scent you smell.
Lemons.
So cranial nerve 1 is intact. Next, we're going to assess for nasal patency. So if you'll cover one nostril, blow in, blow out, and cover the other one, blow in and blow out. So patient has good nasal patency. Next, we're going to palpate his frontal and maxillary sinuses for any tenderness. Is that tender?
No.
Okay. Now we're going to assess the patient's mouth and throat. We're looking at his lips, teeth, gums, buccal mucosa, palate, tongue under the tongue, his posterior pharynx, his tonsils, and his salivary glands. So if you will open your mouth for me. Okay. So buccal mucosa is pink and moist, and say ah. And tonsils are grade +1. Good job. Now we're going to assess cranial nerve 9, glossopharyngeal. So if you'll look up and open your mouth for me and say ah. We're also assessing cranial nerve 10, the vagus nerve, with this. So do it again, say ah. Okay, so uvula rises and falls with phonation, and cranial nerves 9 and 10 are intact. Next, we're going to assess cranial nerve 12, hypoglossal. So if you will, stick out your tongue, lift it up and down and side to side. Okay, so no fasciculations are noted, and cranial nerve 12 is intact. Next, we're going to assess the patient's trachea. It is midline and symmetrical. There's no signs of tracheal deviation. So I'm going to go ahead and palpate the patient's thyroid gland, if you could swallow for me. Okay. And I'm going to palpate his carotid arteries. So his carotid arteries are 2+ bilaterally. While I'm back here, I'm going to go ahead and assess for any bruise on his carotid arteries. You can hold your breath while I do this. Okay, so no bruise are auscultated. Now I'm going to have you turn around. I'm going to be assessing his posterior chest. We're looking for any signs of respiratory distress, any tripod positioning, nasal flaring, retractions, any tachypnea or cyanosis, and none is noted. Everything looks symmetrical. We're going to check for equal chest rise and fall. So if you can take a deep breath for me. Okay, so patient has equal chest rise and fall. I'm going to go ahead and palpate for tactile fremitus. Let me make sure. So say 99 when you feel my touch.
99, 99, 99, 99.
Okay, we're going to go ahead and percuss in the intercostal space. Okay, and I'm going to go ahead and listen to his lung sounds at this time. Okay, now we're going to test for egophony. So if you'll say EE each time you feel my stethoscope.
E, 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 E.
Okay, and now bronchophony, if you will say 99.
99, 99, 99, 99, 99, 99.
Okay, and whisper pectorilically, if you will whisper 99. Okay, now I'm going to have you turn back around. We're looking at anterior chest at this time. We're going to go ahead and check for equal chest rise and fall again. So if you will take a deep breath for me. So patient has equal chest rise and fall. I'm going to go ahead and palpate for tactile fremitus. You'll say 99.
99, 99, 99.
Okay. And I'm going to go ahead and listen to his anterior chest. Okay, so patient's lungs are clear and equal bilaterally on posterior and anterior chest. Now I'm going to go ahead and listen to the patient's heart tones. I'm going to be listening with the bell and diaphragm of my stethoscope, starting with the bell. We're going to start with the aortic valve, which is in the second intercostal space on the right. And then pulmonic, which is the second intercostal space on the left. Erb's point, third intercostal space on the left. Tricuspid valve, fourth intercostal space on the left. And mitral, fifth intercostal space on the left mid-clavicular line. Okay, we're going to switch to our diaphragm. Aortic, pulmonic, Erb's point, tricuspid, and mitral. And I'm going to go ahead and palpate for the point of maximum impulse, or the PMI, which is in the fifth intercostal space mid-clavicular. And then I'm going to listen to my apical pulse, which is in the fifth intercostal space mid-clavicular. And normally I would do this for a full minute. So we'll just say that his heart rate is 68. He's normal sinus rhythm. There are no murmurs or extra heart tones noted, and S1 and S2 are noted. Now I'm going to have you go ahead and lie down. Keep your head at a 30 to 45 degree angle. We're going to assess for JVD, so if you look to the left and then to the right, so no JVD is noted, so lie flat for me. At this point, I'm just looking for any heaves and lifts in his chest, and none are noted. I'm going to palpate for any thrills. So we're going to start with aortic, pulmonic, Erb's point, tricuspid, and mitral, and no thrills are noted. I'm going to go ahead and listen to his heart while he's lying flat, starting with the bell of my stethoscope. Aortic, pulmonic, Erb's point, tricuspid, and mitral, and then with my diaphragm. Aortic, pulmonic, Erb's point, tricuspid, and mitral. I am also going to listen for any bruise in his arteries. We're going to start with his aortic artery. renal arteries, iliac arteries, and his femoral arteries. Okay, so no bruise or auscultated. Next, I'm going to assess his abdomen. It is flat and symmetrical. I'm going to go ahead and auscultate each quadrant. For his bowel sounds. So he has normal active bowel sounds in all 4 quadrants. Now I'm going to go ahead and percuss all 4 quadrants. Okay, so dullness is heard over his organs and tympany is heard throughout. Next, I'm going to palpate for any tenderness. Is that tender? No. Okay, and I'm going to go ahead and palpate for his liver. Hold your breath while I'm doing this. Okay, and I'm unable to palpate the liver, which is a normal finding. Now I'm going to move to his spleen. And I'm unable to palpate his spleen, which is also a normal finding. You'll go ahead and sit back up and just turn this way for a second. We're going to assess for CVA tenderness, so tell me if this is tender. Is that tender?
No.
Is that tender?
No.
Okay, go ahead and turn back around. So at this point, we're going to assess the patient's musculoskeletal system. I'm going to start by looking at the joints in his fingers, wrists, elbows, and shoulders. So with his fingers, first we're going to start by assessing, or what I'm looking for is any redness, tenderness, edema, deformities, nodules, or crepitus, and none is noted, and he is symmetrical. So I'm going to assess for capillary refill. So he has less than 3 seconds bilaterally. Now I'm going to palpate his radial pulses. So he's 2+ bilaterally on his radial pulses. Next, I'm going to assess his range of motion. So I'm going to have you copy what I do with my hands at flexion. And this is the range of motion of his fingers. Flexion, extension, hyperextension, abduction, adduction, and thumb opposition. Okay, and in the wrist, flexion, extension, hyperextension, ulnar deviation, radial deviation, and rotation. And then we're going to do the elbows, flexion, extension, hyperextension. And then your shoulders, flexion, extension, hyperextension, internal rotation, external rotation, abduction, adduction, and circumduction. Okay, good. Next, I'm going to now I'm going to assess the patient's grip strengths. So we're going to start with his hands. If you'll squeeze my hand, so he has 5 out of 5 grip strength. Now we're going to do his biceps and triceps. So if you can push up and then pull down. So he has 5 out of 5 bicep and tricep strength. Now we're going to do his shoulders, his shoulder girdle. So if you'll do your arms like a T and then push my hands towards the ceiling and then pull back down. So he has 5 out of 5 strength in his shoulder girdle. Next, I'm going to assess cranial nerve 11, the accessory muscle. So if you will lift your shoulders up and down. Okay, so cranial nerve 11 is intact. Next, I'm going to assess for cerebral coordination. We're going to start with finger opposition. So if you'll take your thumb and touch your fingers as fast as you can, serial finger opposition. Okay, and then do your hands back and forth on your thighs. Okay, and we're going to do the finger to finger test. So touch my finger, touch your nose, touch my finger, touch your nose, touch my finger, touch your nose, touch my finger, touch your nose. Okay. Now we're going to go ahead and assess for graphesthesia. So if you'll close your eyes, hold out your hands, and tell me what number you feel me draw.
7.
The other side.
3.
Okay. Now we're going to test for stereognosis. Alright, so close your eyes again and identify this object.
Safety pin.
Mm-hmm. And this one?
Coin.
Mm-hmm. Okay, good job. Now we're going to look at his upper and lower extremities, assessing for overall warmth. So his skin is warm and intact, everything is symmetrical. We're going to go ahead and move to light touch sensation. So if you can close your eyes and tell me where you feel my touch.
Leg. Arm. Leg. Arm.
Okay. Next, I'm going to assess your vibratory sensations. So starting with the wrist, you can hold both your wrists out for me. Let me know where you feel the vibration.
Now.
Okay.
Now.
Okay. And the medial malleolus or the ankle.
Now. Now.
Okay. Now I'm going to assess the patient's deep tendon reflexes. So we're going to start with your upper extremity. So if you'll hold your arms out, we're going to start with brachioradialis, biceps and triceps, brachioradialis, biceps and triceps. Okay, and then we're going to do your patella, Achilles, and then Babinsky. Okay. Now I'm going to assess the patient's joints in his toes, ankles, knees, and hips. So we're looking for any, again, tenderness, any swelling, deformities, crepitus, or nodules, and none are noted, and they are symmetrical. I'm going to start with assessing palpating capillary refill in his toes. So capillary refill is less than 3 seconds bilaterally. We're going to palpate his dorsalis pedis pulse, which are 2+ bilaterally, and his posterior tibial pulse, which is 2+ bilaterally. Okay. Next, I'm going to assess the strength in his ankles. So if you can push towards the floor and pull up. So he has 5 out of 5 strength in his ankles. We're going to assess your hips, or no, your knees. So push out and pull back. So 5 out of 5 strength in his knees. And then your hips, push in and push out. So 5 out of 5 strength in his hips as well. Next, we're going to assess his range of motion in his toes. So if you can follow with your toes what I do with my hands, with flexion, extension, hyperextension, abduction, and adduction. And then your ankles, you're going to do dorsiflexion, plantar flexion, inversion, eversion, and rotation. Okay? Now I'm going to have you go ahead and stand up, and we're going to assess the range of motion in your hips. So we're going to start with flexion, extension, hyperextension, internal rotation, external rotation, abduction, adduction, and circumduction. Good. And then the other side, flexion, extension, hyperextension, internal rotation, external rotation, abduction, adduction, and circumduction. Good. And then your knees, we're going to do flexion, extension, hyperextension, and then your other knee, flexion, extension, hyperextension. Okay. Now I'm going to have you turn around and bend over like you're touching your toes. We're going to assess your lumbar spine. So at this point, we're looking to see everything is symmetrical. There are no deformities noted, no scoliosis. His spine goes concave, convex, concave, and the position he's in now is lumbar flexion. So if you'll stand back up, and this is lumbar extension, and then look up, bend back, that's lumbar hyperextension. And then lateral flexion, rotation, rotation. Good. Next, we're going to assess his cervical spine. So put your chin to your chest. That's cervical flexion. Look back up, that's extension. Look up at the ceiling, that's hyperextension. Ear to shoulder, lateral flexion, other side, lateral flexion. Look back at me, that's rotation. Look back at me, rotation. Good job. Next, we're going to assess the patient's walking, tandem, and regular. So if you can take a few steps forward. And skip this way so that you're in the camera for tandem walking. And then you're going to do heel to toe for tandem walking and come all the way out here with it so you can be in the camera. Okay, so this is tandem walking. And if you'll turn back this way, we're going to do the Romberg test. So close your eyes, check for balance. So the patient has good balance. And hop on one foot for me. And then hop on the other foot. Okay, good job. And this concludes my head to toe assessment.